I did some research on urologists out here in Arizona and found Dr. Simoncini. He agreed to take me on as a patient and examined me and gave me the course of treatment that he wanted to do a biopsy, and based on the results of the biopsy we would see what the course of treatment would be. The biopsy, of course, showed that I had prostate cancer. Upon receiving that news, Dr. Simoncini gave me what options were available to me: doing nothing, having the radioactive seeds, having surgery, and of course that was not a decision I needed to make again. I'd already made it. I told him I wanted the surgery.
John had a screening PSA, and it was slightly elevated. We did a biopsy of his prostate, and it showed a small amount of prostate cancer and not a real aggressive prostate cancer. He could either watch his cancer, have surgery, or have radiation. A lot of physicians might have advocated just observation for him. This was attempted back in the early 90s also, and mostly what I saw back at that time was patients with a curable cancer would be observed until it became an incurable cancer, and then they'd have surgery or radiation, and they'd go on to have a miserable outcome. John elected to have a robotic-assisted radical prostatectomy, and he did superbly with this. He had really no long-term side effects. Interestingly enough, many times when we take an initial biopsy, even though it looks very non-aggressive and a small amount of the biopsy, in John's case and in many cases, the cancer comes back significantly more advanced and being a lot more aggressive than what was in the initial biopsy. Prostate cancer and cancer patients in general, I don't think you can put them in a box. Everybody's an individual, every tumor is individual, and every treatment is individual. And many times these cancers are very aggressive and they can be life-threatening, and in John's case it would have been if he didn't have early intervention. In
2013, I think it was during the summer, and that went well. I think I stayed one night in the hospital and was released, and I thought was doing quite well with my recovery. After that kind of prostate surgery, you have issues where you may see blood in your urine, and I thought I had stopped having those issues, and several months later I started having that problem again with blood in my urine. I went back to Dr. Simoncini, and he said, of course, that shouldn't be happening. So he did a procedure where he scoped my bladder. It was a tumor in my bladder that Dr. Simoncini found, and he gave me an option of going anywhere that I wanted for treatment. He wanted me to have chemotherapy. He pointed out to me that he was a part of the Ironwood physicians. He said, well, I don't know where you want to go for your chemo. You can stay with us, or you can pick whatever facility that you want to. And I said, oh no, I'll stay right here, Ironwood Cancer and Research. That's where I want to go. They removed what they could of the tumor, and then I was referred to Dr. Halber at the Ironwood Cancer and Research for chemotherapy.
When I first met John, he was referred to me from Dr. Simoncini for evaluating his bladder tumor. So we met with him, kind of reviewed his history, looked at his records, pathology, spent some time as well speaking with the pathologist to understand exactly what we were dealing with. And then from that, worked him up more with staging to figure out if his illness had spread anywhere. And then from there, set forth the treatment plan. When he was referred in, I knew what he had by the time he got to me. And it was kind of meeting him and learning more about his story, his other medical problems, to help me know my recommendations may be, but kind of learning more about him helped me set more in place what the overall plan was going to be. John is an amazing man, very informed about his illness, works well with the good doctors and nurses and the rest of the team. So he was a gem to take care of, and really appreciate the opportunity to be involved with him.
Dr. Halber put me on a very aggressive chemotherapy regimen.
Thankfully, his tumor hadn't spread anywhere outside the bladder. He had a big tumor, looked like it was an aggressive tumor, but thankfully it hadn't moved anywhere. Based upon the type that it was, which was relatively rare, we knew that chemotherapy was going to be his best chance. So he initiated about 3 to 4 months of chemotherapy, and as anyone who's been around someone on chemotherapy knows, it's not an easy process.
Even with the common problems patients have with chemotherapy, John just kept moving forward and did fantastic. Dr. Halber obviously did a fantastic job because there were no cancer cells even left after the chemotherapy, so he picked a regimen that worked superbly for him. And again, that's the best part of being a part of a multidisciplinary cancer center, is you have everything right at your fingertips. You can streamline treatment. The worst case scenario is your consultant is one of your partners and he's a phone call away. Everybody's right there to work together.
You know, the medicines that he received were those that have more likelihood of making him sick. And he had a fair amount of nausea, needed a lot of medications to help limit that and support him, and that's where he interacted a lot with our nurses.
The team approach was awesome. The chemo nurses were just, I can't say enough good about them, and of course Dr. Halber and his staff and Dr. Simoncini, I can't say enough good about them either.
When we see a patient that's referred in who we're seeing in the consultation, you know, we get members of the team involved, if it be, you know, if they need to be evaluated for a radiation oncology, or if we're counseling them more about the chemotherapy. And patients are, I think, appreciative of the structure in that under one roof they have all the services that they're going to need to treat their illness. And so as they go through the office, it's not me having to make a call and get a, you know, kind of wait to get a response back. I could meet with the other specialist that's there, and it's much more streamlined.
We have everything right at our fingertips. You get on the phone, call one of your best friends, and you can streamline treatment very easily that way. I spoke with Dr. Halber basically the minute I walked out of the room with John, and we discussed the case and started setting up a treatment plan for him.
Kind of working through the side effects, and he was meeting with me on a regular schedule as well, and we were monitoring his labs, seeing how he's doing them, and hitting his disease relatively aggressive in that we wanted to make sure that we could knock out as much as we could. And as we were going through, he had follow-up scans which showed that the mass was shrinking, symptoms were improving, and so we're optimistic that he was on the right track. And then as we completed with his chemotherapy, then that's when he had updated scans, follow-up with Dr. Simoncini, and then eventually his bladder was removed.
Now I've almost 2 years of cancer-free. They all got together and took very good care of me. I'm forever grateful to all of them. I tell him that all the time. He doesn't like to hear it, but I tell him.
I take great satisfaction knowing that we give patients the best medical and oncological care we can in a warm, caring, comfortable environment during a very difficult time of their lives. At the end of the day, it's about the patients. You know, really, we try to get the best treatment outcome for them possible. The way I look at it being a cancer survivor is there's no good time to have cancer. You have to take a block of time and go through the treatment and get better and get on with your life. And being part of this center makes that possible.